Welcome back to Face the Nation. For more on Afghanistan, we turn to Ryan Crocker, who served as the U.S. ambassador to Afghanistan. Mr. Ambassador, good morning. Earlier this week, you said you had grave concerns about President Biden's capacity to lead. What specifically did you mean by that?
What I meant by that, Major, is the way not only how his decision was made to withdraw, but then its execution, which has been so far catastrophic. We've got desperate people, American citizens, other Afghans we've helped, you name it, doing anything they can to get out of Kabul. And we will all remember that those horrible images of Afghans who had clung to a wheel well on a C-17 dropping out of the sky to their deaths. So the decision and the execution in particular does not speak to competency.
And when you talk about capacity, are you saying anything else outside of what you just articulated, meaning execution and decisions?
Well, Major, we got to be fair here and a little bit honest with ourselves. President Biden didn't create this whole scenario. President Trump did by engaging the Taliban in talks without the Afghan government in the room. That began a process of delegitimization of the state and its security forces. That was a huge contributing factor to where we are now. I mean, that said, President Biden owns it. He's taken ownership of the policy. He has taken ownership of the envoy who negotiated this thing. So lots of blame to go around here, but it doesn't all fall on President Biden.
You are deeply familiar with this region and many of the players. In the next week, Mr. Ambassador, what are you most afraid of?
I am afraid that as the Taliban gains more control, as they settle in a bit more, they are going to go after all of those in Afghanistan who have spoken the truth, who have been in the media, who have represented the institutions of this young democracy, and certainly those who have helped us directly, like the interpreters. I'm very much afraid that this is going to get worse. The chaos may subside, but as it does, I am terribly worried you're going to see the Taliban start to methodically take care of those they consider their enemies. We will be in no position to help them.
Mr. Ambassador, as you're probably well aware, many members of Congress, senators and House office members are creating, if you will, satellite State Departments, trying to use whatever means they have, email, cell phone calls, to try to work on behalf of either constituents or those that they have come to know in Afghanistan to get them out. What does that say about the functionality of the current State Department?
Well, with respect to State Department personnel, I mean, among my heroes are those state people out at the airport right now, doing everything they can to make this process work faster and to work better. That said, there are capacity problems. Those on the front lines did not create those problems and are not in a position to fix them. But it's just incredibly important that we concentrate now on getting those folks out. Look, right as we speak, I am involved in an effort to get a particularly prominent person out of that country before it's too late. It's kind of like the Dunkirk evacuation. So it's a really rough time. It didn't need to be this way. Look, Mike McCall, ranking member of the House Foreign Affairs Committee, and I did a joint op-ed at the beginning of May of when we said, here's what the administration needs to do if they're going all the way out, which we opposed. They've got to have a way to get intelligence capabilities offshore that are going to work and keep our nation safe. They've got to take care, obviously, of American citizens. They've got to take care of the interpreters. They have to take care of those women and girls who are particularly vulnerable. We put all that out there. Again, 3.5 months ago, none of it was acted on.
I'm going to give you 3 countries, China, Pakistan, Russia. Have the events of the last 2 weeks made America weaker vis-a-vis those 3 countries?
It has created a global crisis, quite frankly. It has emboldened violent Islamic radicals. And I think we're all going to see the fallout of that. certainly in Pakistan. They championed the Taliban because they felt they had no choice. Well, the Taliban victory, the narrative of defeating the great infidel, empowers radicals in Pakistan that they're going to have to deal with if they can. And that's a country of 220 million people with nuclear weapons. China has its Uyghur Muslim population in its west. They're tuned in. They're definitely looking at what happened in Afghanistan. And of course, the Russians have their own Muslim populations in very violent places in the past, like Chechnya. So they might be doing a little bit of high-fiving, but boy, it's not going to last, because what is happening in Afghanistan isn't going to stay in Afghanistan. This will be felt around the world.
Ryan Crocker, former ambassador to Afghanistan on behalf of the United States government, coming to us from Spokane, Washington. We thank you, sir, very much for your time and expertise. We'll be right back with the latest on the coronavirus pandemic. We turn now to the latest surge of COVID-19. The CDC says hospitalizations for people under the age of 50 with COVID-19 are now at the highest level since the start of this pandemic, with the largest increases among people in their 30s and under 18. CBS News senior national correspondent Mark Strassman has more from Atlanta.
More than 50 pediatric patients with COVID, a new pandemic record at Texas Children's Hospital in Houston. That anguish will get worse. Texas has low vaccination rates, a governor infected with COVID leading a feud against mandatory masking. And in Houston, K through 12 schools open tomorrow.
This powder keg or tinderbox, however you want to phrase it, certainly could result in many more cases. And that means many more hospitalizations, many more children.
This fourth wave of COVID patients gets sicker quicker. Cases in American hospitals have ballooned, up more than 240% in the last month.
It just makes you feel like you're just helpless.
Nationwide, 4 of every 5 ICU beds are full. Nearly 1/3 of all adult ICU patients have the virus, the vast majority unvaccinated. Oregon is overwhelmed. 1,500 National Guard troops back up frontline workers. And COVID deaths are now up in 42 states.
When they pass, it's hard. I mean, all of this is hard.
More than 1,000 COVID patients died on Friday alone. Sorrow that nearly doubled in 2 weeks.
You are good.
One counterattack that's also trending: mandatory vaccines to get into certain businesses to keep your job. That now includes all nursing home employees by September 30th. The FDA is expected to give the Pfizer vaccine full approval this week. Doctors hope that will encourage reluctant people to roll up their sleeves. Major?
Mark Strassman, thank you. We're joined now by Maryland Republican Governor Larry Hogan. Governor Hogan, it's great to have you in studio.
Good morning.
I have a lot of COVID questions for you, but I want to get to Afghanistan real quick. 3 questions there. What's your appraisal of the Biden administration handling of the situation? How open is Maryland going to be to Afghan refugees? And what are you hearing, if anything, from State Department about how to do that?
Well, first of all, I think it's an unmitigated disaster about the way we've handled the exit from Afghanistan, number one. Number two, I was the first governor in America to reach out and say we wanted to reach out and take more of these special immigrant visas for the folks that have been our allies that we made a commitment to. We've got to stand by them. We've got to get our Americans out, and we've got to get those allies out of there as well. And we're going to do everything we can to help do that. We have a discussion with the State Department tomorrow. We've already received some over the past week or two into our state, and we're going to try to get as many as we can.
Is that information flow from state satisfactory to you?
The information is a little spotty. I think some of that is understandable, but we'd like to have a little more communication.
All right, to coronavirus. You said 2 weeks ago the pandemic is currently under control in Maryland. Is that still true?
Well, it's under control better than in most other states. We're second lowest case rate and positivity rate in America. So we've got 80% of our population over 18 that's been vaccinated. That's one of the best in the country, which is helping us keep this Delta variant at bay. We've got 94% of our vulnerable population, 65 and over. So while it is an issue, we're very concerned about the spread of the Delta variant all across the country, and it has impacted us. Our numbers are going up, but they're going up from a very low place. We're still better off than a lot of people, and we're better able to handle the surge than many other places.
Will mandates for masks or vaccines come to Maryland under your watch?
Well, we've already taken some steps on mandating vaccines for particular groups of people. First of all, we started with state employees who were dealing in congregate settings, dealing with our nursing home, retirement settings for veterans, and in places like our corrections facilities. And then just last week, in conjunction with the hospital association and the nursing home association, we've mandated vaccines for workers in those two facilities that are dealing with the most vulnerable people. We had a mask mandate for quite some time, which was lifted back on July 1st, but we're still strongly recommending masks for anybody who's unvaccinated. Right now, 100% of our hospitalizations and deaths are unvaccinated people.
But you will not reimpose that mask mandate.
Look, we make our decisions every day based on the best advice we can get from smart people, like Dr. Scott Gottlieb is one of our advisors who's on next. But right now, all of our advice is that we ought to just hold the course because we're doing better than just about any other state.
Some in our audience might know that you're a cancer survivor. As such, have you had the booster shot?
Matter of fact, I did just this week. Strong advice of our team of epidemiologists and my own oncologist. The federal government said that people that have that are immune compromised should get it. I had a cancer of the immune system, so I got it on Monday. I feel great.
Do you want Marylanders to get their booster shot as soon as possible or wait this 8-month interval?
No, we can't wait that long, and we've been pushing the federal government for three things. One, we're pushing to get the final FDA approval, which I think is part of the reluctance on the part of a lot of people. Hopefully that's going to be coming this week. Two, we're pushing to speed up that time frame because we want to start. We're already preparing in our state to start doing boosters for our nursing home residents and people that are in vulnerable populations. We want to get that final okay from the federal government, and we want to push to get it approved for the younger kids that right now can't get it.
With that vaccine approval, full approval from the FDA, which is expected sometime in the coming weeks, will that change any of your policy attitudes? Do you think it will change the mindset of Marylanders who still haven't become vaccinated?
You know, we actually did surveys, and the number one reason stated for the reluctancy or hesitancy to get the vaccine was that it's not approved. So I think that'll help. It may enable us to take further actions that we haven't been able to because of the lack of approval, like, for instance, moving forward on the booster shots on the third vaccine.
Schools will reopen in Maryland in the coming days. Do you want those schools to conduct, as some public health officials have recommended, testing for every child once or twice a week?
Look, we have provided $1.2 billion to our local schools just for that reason. The state has provided the resources to do testing of all of our kids. We also put money in. Part of that money goes to filtration systems, HVAC systems to taking care of the air, stop the spread, slow the spread of the virus. And we're pushing to get those kids approved so they can get their vaccine.
And do you want those children to wear masks?
Right now, we left it up to our local school systems. About 2/3 of them have already made that decision to wear masks. We think that that's where it should be. The duly elected school boards make those decisions based on the facts on the ground in their particular area.
Maryland likes its athletics. There will be football games, professional, college, and high school. How should they be handling the virus?
Well, they've all been taking pretty good steps. So both the professional, we have two professional football teams, the Washington football team and the Baltimore Ravens, and they've got policies in place where they're going to, they've got masking inside the stadiums. Outside is okay. They're going to do some screening when you come in. And our colleges have been really strict. So University of Maryland, the Terrapins, for example, I mean, they've got a requirement for vaccines. And I think somewhere over 90% of their student population has already been vaccinated.
Governor, as I gather it, you are unhappy with some of your local leaders in the distribution of federal funds dealing with evictions. Why are they not spending the money rapidly enough? And how are you leaning on them to accelerate that?
Well, I just got back yesterday from the Maryland Association of Counties convention where we bring all of our local leaders together, and I just stressed the point with them. We've provided about $100 million of state money and $400 million of federal money. We provided assistance for people to help with rental assistance for, I think.
Well, what's the holdup?
The holdup is simply that it's a bureaucratic kind of process. There are some federal hoops you have to jump through. It's not as easy as just handing out the money. But we're working through that with those locals to try to make sure they get it done faster.
So where do you need help? Do you need help from the federal government, or do you need them to accelerate the pace of this spending?
We need a little bit of both. So we got all the money out immediately to the local. Some of it went directly to the largest jurisdictions. The smaller counties, we immediately got it out to them. They've got to do a better job of distributing it, but we're also going to push at the federal level to say, hey, let's ease up some of these requirements so we can get it done.
For someone who's facing eviction, this sounds like a nightmare. Are you as mad about this situation as they likely are?
I'm pretty frustrated about it, and I let some of our local leaders know that yesterday. But you know, the good news is that we've had 15 straight months of job growth, one of the best economic recoveries in the nation, and we don't have as big of an eviction problem as other states. But we do want to help the people that are struggling.
A lot of topics. Governor Larry Hogan, Republican from Maryland, thanks so much for joining us.
Thank you.
I appreciate the time. And we'll be back in just a moment. We turn now to former FDA Commissioner and Pfizer board member, Dr. Scott Gottlieb. His book, Uncontrolled Spread, Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic, comes out next month. Dr. Gottlieb, good morning. Do we know in this country how many young people have COVID-19 Delta variant, and are we testing enough to get an accurate sense of that number? And how far off might we be?
Yeah, we may be very far off. We don't have an accurate sense of that number. Right now, about 4.2 million kids have been diagnosed with COVID, but the presumption is that we're diagnosing just a small fraction of the kids who are ultimately contracting the virus. Maybe as low as 1 in 10 to 1 in 20 infections in kids is being turned over right now. So there's been far more infection among children than what we're diagnosing, because most of the infection is asymptomatic or mild disease that doesn't necessarily present to a pediatrician for testing. And this is really a critical question because it gets to the heart of whether or not this new Delta variant is more pathogenic in children. We see rising numbers of hospitalizations and ICU admissions among kids. The question is that because this is a more dangerous variant in children, or are we just infecting a whole lot more kids? So we're not really getting an accurate sense of the denominator. We're only seeing the numerator of kids who are presenting with more severe disease. I suspect it's the latter. I suspect that the number of kids who are getting into trouble with COVID hasn't really changed with this Delta variant. The reason why we're seeing rising hospitalizations and ICU admissions among kids is because we're infecting a whole lot more kids with it.
So doing that quick math, we could have 10 million to 20 million cases right now, if I heard you correctly.
Yeah, well, there's 50 million school-aged children. We've diagnosed a little over 4 million. About 8 million have been vaccinated. So the question is how many kids overall have been exposed to this virus and developed some measure of immunity. It could be as high as 25 million or more when you start doing the math around that 4.2 million who are known to have been infected. We're certainly diagnosing less than 1 in 4 cases. In the peak of the epidemic in the winter, we were turning over probably about 1 in 4 cases in adults. We always knew the fraction of cases that were getting diagnosed in kids was less. We're doing less routine screening in children. Children get milder disease on the whole, so they don't present to their pediatricians for testing. But the ascertainment rate right now may be even lower with this Delta variant.
So should school districts be testing on a regular basis when children return? And when you say regular, is that once a week, twice a week, more?
It's once a week or twice a week, and if you Google test to stay, there's now a movement in a lot of districts. North Dakota's doing this, some other states as well, to use testing as a way to keep kids in the classroom. So when you identify a case, rather than quarantining the whole class or a large swath of the school, which is happening in a lot of states right now in the South as the epidemic rages there, what some districts are doing is using testing where they'll test the close contacts of kids immediately to make sure there's not other asymptomatic cases that are going undiagnosed, and then test them at some kind of interval, maybe at 3 days and 5 days, to make sure that there's not an outbreak being triggered in the school. So you can use testing to avoid broad quarantines. I think the combination of kids wearing masks in the classroom to avoid spreading the virus with testing can allow the school year to go on without these large quarantines that we're seeing in some districts while keeping children safe.
And on that question of quarantines, is that the proper policy response?
Well, again, I think a proper policy response might be to use testing more aggressively to try to identify infection to make sure you're not having an outbreak in that setting, and also make sure you're taking mitigation steps to avoid that as well, with masks, with proper ventilation, keeping kids in defined social pods. I think the combination of those two measures can create a safer environment, not a safe environment. Schools aren't inherently safe, but they can be made more safe without putting large groups of students in quarantine. In one district in Hillsborough, Florida right now, around Tampa, there's been 2,700 kids have been diagnosed with COVID. About 6% of the kids in that district are in quarantine. You're seeing that all across the South right now. It's going to be very disruptive to the school year. And then once these districts either do go to a hybrid model or shut down or put a lot of kids into quarantine, it becomes very hard to restart a normal school year. So you want to prevent that from happening while keeping kids safe. I think testing could be used as a very effective tool to do that. And some states are leaning hard into that.
Are case rates beginning to peak in the South where the Delta variant has hit the hardest?
Yeah, that's definitely the case. If you go to covidestim.org, run by the Harvard Chan School, which looks at whether the epidemics are expanding or contracting, they're showing across the South right now the RT, the rate of transmission, is below 1, which means you have a contracting epidemic across the South. Now, there's still very hard weeks ahead because they're still going to continue to accrue more hospitalizations, and there's extreme pressure on those healthcare systems. But there is evidence that the epidemic is starting to slow and the day-over-day cases are starting to decline, and that's showing up in the national trends. Now, Florida, which has been the epicenter of the epidemic in this country, if you look across different age categories in Florida, every age category shows a declining number of cases day over day, except for school-age kids, ages 6 to 19. That's the only category that's still expanding, and expanding very quickly, because what's happening is they're opening schools earlier in the South, schools open earlier in the South, against the backdrop of still a lot of prevalence, and the infection's getting into schools, and it's proving to be hard to control in schools. Delta's a very contagious variant. And so I think that this is a harbinger of the challenges that we're going to face nationally as schools reopen. The schools could become focal points of community transmission and could become environments that aren't safe for children if we can't control very large outbreaks from happening in those settings.
Doctor, do you expect the Pfizer vaccine to be approved fully this week? And if so, what difference will that make?
Yeah, as you know, I'm on the board of Pfizer. There were reports that it's going to be approved as early as tomorrow. I have no reason to believe that those reports aren't accurate. I do believe that once the vaccine's fully approved, that's going to give more impetus to some businesses, schools, to mandate vaccination. They've been waiting for a full approval. They feel they'll be on stronger legal ground to mandate vaccination in that setting. I also think that there's certain consumers that have been waiting for this milestone, waiting for the full approval and an indication that the FDA is done evaluating the data set to give them more confidence about using the vaccine. So I would expect to see some uptick in vaccine utilization, either from voluntary vaccination by consumers who've been waiting for a full approval, or from some businesses that now are going to move forward with vaccine mandates, although you've been seeing businesses doing that even in the absence of the full approval while the vaccine's been under an emergency use authorization.
For your time and expertise, Dr. Scott Gottlieb, we thank you very much. And we'll be right back. That is it for us today. We thank you so much for watching. For Face the Nation, I'm Major Garrett.